Now, President John Dramani Mahama has charged African leaders to build a resilient and self-sufficient health system which aligns with national priorities for health sovereignty. The president was speaking at the African Health Sovereignty Summit, which was held in Accra.
Africa Health Sovereignty Summit brought together African heads of state, policymakers and global health stakeholders to discuss and endorse the Accra Initiative, a bold roadmap for reforming global health governance, fostering a new era of health sovereignty rooted in national ownership, investment and leadership. The summit has become necessary as a result of the urgent need for an overhaul of the current global health framework, which no longer reflects today's geopolitical realities.
The shift reflects clear feedback we receive from governments, partners, and communities across the continent that called for a more flexible, inclusive, and dynamic approach to healthcare sovereignty.
Former President of Nigeria, Olusegun Obasanjo, would want the expansion and enhancing of the national health insurance schemes across member African states.
And 25% of our health insurance fund can be used to manage our health architecture and go into health infrastructure.
The Director General of the WHO is of the view Africa does not need charity, but rather fair tariffs.
We must all adjust to this new reality. But in this crisis lies an opportunity to shake off the yoke of aid dependency and embrace a new era of sovereignty, self-reliance, and solidarity.
In his opening remarks, President Mahama emphasized the need for Africa to take charge of its health destiny, stressing that the continent must no longer be a passive recipient of aid, but instead take full ownership of its health agenda.
Africa must no longer be the patient. It must be the driver. It must be the author. It must be the architect and the advocate of its own health destiny. And I extend an open invitation to all nations represented here to join us in building an African health investment ecosystem that is driven by purpose and is powered by equity and anchored in our sovereignty.
Key outcomes of the summit include launch of the sustained initiative endorsement of the Accra Compact and creation of a presidential high-level panel to develop a reform agenda for global health governance aligned with national and international efforts.